again, everyone, and welcome back to Reddit Aliens. I'm John, and as always, thank you so much for being here. An interesting topic. Let's do it. Doctors of Reddit. When was a time when a patient came in presenting mild symptoms that turned out to actually be life-threatening? Please remember to like, share, and subscribe. My dad woke up with severe back pain one morning after not doing anything strenuous the weeks or days leading up to it. My mom flipped her shit and finally put her foot down that he had to go to the doctor after putting off going to a doctor for years, even for a routine checkup. The appointment showed a broken rib from a huge tumor on his spine, along with tumors around his buttocks, pelvis, and upper back. Diagnosed with stage 4 lung cancer. 5 years and 100 treatments later, he's still kicking it. Many years ago, when I was in my residence, a man entered ER with a hand on his forehead, walking by himself asking for a doctor. You can imagine my surprise when I said yes to him removing his hand and showing his injury, a perforating hole from a bullet. He was quickly moved to surgery after that. Later, I found the bullet didn't reach the brain. It was well buried into the skull bone. Saw a patient with minor cardiovascular symptoms and a slight pain in his upper back. The senior debated back and forth whether to make sense to run a CT to rule out anything more serious. She finally decided to do it, and it turned out he had a massive aortic dissection and was basically wheeled right into the OR. A man came to the hospital because his wife always complained about his bad breath. Long story short, I met him because they consulted my department when the tissue biopsy came back as esophageal cancer. That's terrible. You think something is mild. I mean, obviously there was concern, but you wouldn't expect in that short amount of time to come back to that. Sorry for that woman and that family. I'm a dentist. New PT came in with what he thought was a mild ache in his teeth. Thought it was a toothache. Hadn't seen a dentist in years. Took a radiograph and the jawbone around the teeth looked strange. Had him see an oral surgeon that day. Turned out was a very aggressive metastatic bone cancer and died a few weeks later. My son, 6 weeks old. He was also 6 weeks premature. Only symptom at the time of me bringing him to the ER was inconsolable crying and wouldn't drink his breast milk. Was told by others that I was just being a paranoid first-time mom. He probably has gas or was colic. My instincts just told me otherwise. Brought him to the ER. Triage asks me what my concerns are. I told them he won't stop crying and I can't get him to eat. A couple hours later, my 6-week-old baby coded blue and went into respiratory failure. Code blue pediatrics will forever be the most haunting thing I ever heard. Since he was so tiny, they were having incredible difficulty intubating him. Was being kept alive in between attempts with that bag thingy, unsure what it's called, and compressions. His diagnosis was late onset group B strep, sepsis, and bacterial meningitis. Had I not brought him in when I did and waited, my son would not be alive today. So yeah, listen to your instincts. You have them for a reason. I'm a nurse, not a doctor, but we had a guy come in years ago asking for a medication to help him stop sweating. He said he had had a sore throat for about a week, went to a walk-in clinic, was diagnosed with strep throat and put on antibiotics. But he was so sweaty and just wanted a break from it. He looked pale and was indeed sweaty, so we took him back and ran some blood tests. His white blood count was the highest I've ever seen, and he was diagnosed with leukemia. We sent him to another hospital for immediate treatment, but we were informed he died literally hours after arriving. Incredibly sad. Couldn't believe it. Patient's wife called. Patient had a temperature of 98.6. No other symptoms. I explained that was a normal temperature, but the wife said that's a fever for him. She said she felt like something was wrong despite no other symptoms. I told her that I respect that, and that if she feels something is wrong, she should get him checked out in the ER. The ER doctor called 4 hours later and said they did all they could do for him, but he died of sepsis. He appeared to be normal when he got there, but rapidly declined. Still in school, and I was not present for this patient's initial admission, but Rather her clinic follow-up, however. Patient was healthy 50-something-year-old who had extended nosebleed after a long hike. It wouldn't stop, so they went to ER to get it cauterized or impacted. Happens all the time. Anyway, they did a CT scan as protocol and discovered she had a 20-centimeter tumor on her uterus that was wrapping around her right kidney. She was immediately referred to a serious academic hospital and had a specialized oncology surgeon remove it. Amazingly, they got it completely removed without even having to damage the kidney. She had an amazing outcome and about half-a-foot scar running around her abdomen from the surgery. 8-year-old girl gets brought in complaining about back pain she'd had for 3 months. Several different doctors had given her painkillers to no avail. After about 5 minutes, I asked her if she had any problems going to the toilet, and she says it's foamy when she pees. Bone cancer. She made a full recovery, and from what I know is in her 20s now. But to this day, I hate how she'd been suffering for 3 months, and no other doctor had bothered to even ask any more questions as to why an 8-year-old girl was getting severe back pain. When I worked in A&E, I had an elderly man come to Miners with his son-in-law. Symptoms were constipation, mild stomach pain, and a bit of abdominal distension. They were just asking for laxatives to relieve his constipation. I examined his abdomen and found a firm central mass, which was a bit unusual. We're taught in medical school to assess for an abdominal aortic aneurysm by putting fingers in a triangle around the belly button, so I did this. And as soon as I did, I saw my hands pulsating strongly back at me. Immediately, I started crapping my pants. Ordered the man a CT, which showed an abdominal aortic aneurysm with an outpouching with an extremely thin wall. This guy was immediately moved from Miners to resus and then straight to surgery. Surgeons say if he'd sneezed, it would have ruptured. Very bad news. You would lose your entire blood volume in mere minutes. I looked him up afterwards, and amazingly, he survived to discharge hospital following surgery. Although, don't know how he did long term. It was pretty terrifying for me, as you could potentially have mistaken that for a hernia or a fascial loading if you didn't examine him properly. But that's probably my main time I saved a life story. I'm a nurse, so naturally my mother called me one day when she had strange symptoms. Earlier today, I had this feeling like there was a squirrel running around in my belly. I reassured her that it was probably gas. It happened again a few days later when she was in the car with me. Something made me take her right to the emergency room. The doctor evaluated her and basically accused her of making things up. I asked for a different doctor because she is not a complainer or a drug seeker. Turns out it was a malignant brain tumor, glioblastoma, that was manifesting itself as abdominal seizures. They said she had 1 to 2 years to live. It's now 7 years since surgery, chemo, and radiation, and she's still alive. My husband was a pathologist's assistant for 30 years and did autopsies. Guy goes to ER feeling unwell. A couple tests are performed and he's diagnosed with stress, which means, I don't know, and sent home. ER shift change. Quiet time in the ER, and a bored doctor reviews cases from earlier in the day. She sees something she doesn't like in the guy's test results and sends an ambulance to the guy's house to bring him back, dead on the floor inside the door. Poor guy ends up on my husband's table, and the hospital gets sued. Not a doctor, but worked as a security supervisor at a hospital. Man and his wife came in. Man is feeling unwell, thinks he has like a flu or a cold or something. I can't remember exactly what. Nothing serious, but they don't have a family doctor, so they came to ER. Man gets in line for triage, and his wife leaves to go park the car after dropping him off. Like I said, I'm not a doctor, but how it was explained to me was part of this man's digestive tract just exploded because he sits down and within 30 seconds he's slouched over and dead. My guards respond, realize he's not responding or breathing, and pull him onto the floor and start doing compressions. EMS and nurses quickly join us from the back and rush him to a triage room, but whatever happened wasn't recoverable. Wife got back into the ER, just expecting him to be hanging out in line. Instead, are met with my guards telling her husband is dead in the back with staff trying to bring him back. Like, I can't even imagine how that is from the wife's perspective. She leaves with her husband, basically fine, and wasn't gone for more than 5 minutes, and comes back and he's just gone. I was on a break at the time and missed the situation, but had come back and deal with some shell-shocked guards. 26-year-old seemingly healthy male came to my office, eye doctor, with complaints of mild blurry vision, usually a very routine complaint and a very easy fix with glasses or contacts. After a few minutes of trying to get him see better with the reflecting lenses, I wasn't able to improve his vision when it shouldn't take that long for someone that young. I decided to quit trying and quickly look in the back of his eye. Hemorrhages everywhere, swollen optic nerves. He ended up having malignant hypertension, causing his retina to swell. His blood pressure was 270/170 in office, which could have made him have a stroke at any minute. We physically drove him to the ER, where he was admitted. Not a doctor's perspective, but my dad went to his doctor because he suddenly didn't like the taste of broccoli. Dad was otherwise healthy, late 60s, fairly active guy. He was diagnosed with leukemia. I was the patient. My mom kept bringing me to the doctor because I was continuously complaining of tummy pain. I had just started school. The doctor said I was likely just trying to get out of school and stay home with my mom. I complained the whole school year. She even brought me to the ER a few times, and they essentially said the same thing. They never did any imaging, sometimes blood work. Finally, one day I started peeing blood, and she took me right to the children's hospital, and I was diagnosed with stage 4 kidney cancer. By then it had spread to both lungs, liver, lymph nodes, and around the heart. Mom was constantly in and out of the doctor's offices and ERs for many things, such as extremely tired, extreme weight gain, periods lasting months, and a bad case of dehydration. Finally, an ER doctor took notice and sent her for a CT and found a grapefruit-sized tumor in her vena cava, later diagnosed with stage 4 leiomyocarcinoma. Gave her a few weeks to live, but she battled for about 5 more years. I was the patient. Spent 6 months being told I had a bad cold and anemia, so I should take iron pills. Turns out I had an autoimmune disease and my kidneys were failing. I eventually ended up on dialysis and with a transplant. Not a doctor, but this story is about an elderly but not ancient relative. Background: I had a hysterectomy due to general uterus shenanigans in 2019. My surgeon is awesome. I had a great surgery and easy peasy recovery. So one day this relative calls me out of the blue and says, "What was the name of the OBGYN who did your hysterectomy?" And I tell her and ask why, knowing that this person has been through menopause for a long ass time. "Wouldn't you know it? I got my damn period this morning. I thought I was done with this shit." Well, my friends, the reaction of, "Oh hell no, I'm done with this shit," turned out to be a lifesaver. Because what she thought was just menopause being weird turned out to be endometrial cancer, caught super early. She had a hysterectomy, 1 round of radiation, and is cancer-free 3 years on. Bleeding after you've been through menopause is suspicious as hell. Yins? I did, among other jobs, administrative physical exams for my employer for decades. This happened over 2 decades ago. Patients had a chest x-ray and some basic labs before they were seen. I got an x-ray report that said the patient's mediastinum appeared a bit wide, and I should consider a CT scan to evaluate for an aneurysm of the aorta. Whoops. I called the patient, whom I had never seen. He was not having any chest pain and felt like his usual self, but agreed to have the chest CT done. For whatever reason, radiology did not do a full chest CT as I had ordered, but did one limited to the aortic arch and below. The aorta and mediastinum were normal, but the CT report mentioned some minor stranding extending from the left hilum of the lung extending towards the left upper lobe, which was not shown on the CT because they did a limited exam. Okay, I called the patient back, whom I still had never seen, and told him what the CT scan showed. Upon questioning, he said he had some minor pain in his left scapular area, behind the shoulder, a year before, and had seen a clinic at the different hospital, which had done a series of x-rays, and nothing was wrong. The upper back shoulder pain had not really changed over the intervening year and had grown used to it. The vicissitudes of aging. So, I reordered a chest CT and asked radiology to do it as ordered, which a few days later they did. Double oops. The full CT scan showed a penocast tumor at the apex or top of the left lung that had extended into the chest wall and destroyed segments of several posterior ribs, which explained the pain the patient was having. This is a very bad thing. I called the patient back again. His appointment to see me was not for several weeks, and he needed to know. He took the very bad news surprisingly well, got copies of the CT scan, and went to a local cancer hospital for further evaluation and treatment. I never actually saw him. I've had a couple patients come in and complain about usually mild issues, like floaters or blurry spots, but after questioning them, it starts sounding worse and worse. But one lady came in and fit the stereotypical Karen template. She was rude and demanded to be seen on a Saturday that was already fully booked. I told the staff that she could wait, and I would get to her as soon as possible. It took me almost 2 hours to get to her. She complained of a spot in her vision, usually a floater and usually harmless, but I looked in her eyes and saw bleeding in her eye, just off the optic nerve. I asked about headaches and she confirmed. I told her she had to go to the ER immediately, and if she felt off to drive then I'd call an ambulance. She looked at me like I was crazy. I eventually convinced her she had to go right now and get checked out, as she was at risk for a stroke or aneurysm. The next day the ER called and asked if I'd be coming to see her for the rounds. I was surprised and said, I don't have any hospital privileges, I'm just an optometrist. Turns out her blood pressure was sky high, and they gave her some medications to lower it. Then her pressure dropped so low that her heart stopped, and they had to shock her back into rhythm. She came back the next year for her annual eye exam and told me I saved her life. The doctors told her she could have keeled over dead at any minute, and she still had the gall to be rude as F to everyone at the office. Neurologist here. A healthy patient came in with a few months' history of left-hand numbness. My first thought was carpal tunnel syndrome, but physical exam was not convincing. I got CT, head, and found malignant metastatic lesions. Patient and family were talking about expensive designer bags, but were very happy. I had to break the news. They went from healthy to potentially a few months to live. Sometimes I hate my job. This is a story from my mother, who is a sex therapist. She was treating a teenager who basically was masturbating so hard and often that he was rubbing his junk bloody and bleeding through his pants. The kid insisted it wasn't sexual. He was just really uncomfortable and his skin hurt. He got boners rubbing the skin. The doctors didn't believe him and sent him to my mother. My mom, devil she was, had a saintly moment and listened to the kid. She suggested he see a dermatologist. Kid literally had dick cancer, something with an S-cell carcinoma. My mother never saw the patient after their parents called to cancel appointments because they found the cause, and he was no longer in need of her services.